Hello everyone. I wanted to tell you a story. It's a funny story, and it would be even funnier if it wouldn't be true, but it is true. So, what happened the other day is my friend met somebody at the store, and she lives in Texas. And the man told told her what happened to him. What happened is that he packed up his wife and two kids in order to go to the testing place to be tested to see if he had a virus called COVID-19, in case you ever heard of this. So he goes to the place, and God forbid he should go into the building. They go and fill up all the information online. He stays in the car, and on his phone he fills up all the application for himself, for his wife, for his two kids. And so he waited because there's a long line. So he waits, and they were all waiting for a very long time. Forget about the kids in the car. He could not wait anymore. He said to his wife, "Look, I have to go to work, so we're leaving." So without even going into the building, they just went on their way, and he went to work. So nothing happened, except a few days later. I don't know if he got an email or if he got a regular mail. Probably got an email saying that out of the 4 people in the family, 2 of them were tested positive for having coronavirus. And they let him know they have the virus. Now, I hope you understand that they never got into the building, they never got tested. But this is the kind of story that we have to share. It's not something you hear on the news, and it's something that, between you and me, we talk to each other, we know what we tell each other what's going on. And this is the kind of story that make you think, what is going on? For example, another story that is interesting, but that made it into the news. When I said the news, I mean the newspaper, the media, the radio, TV, whatever else. What happened is that there were a few labs in Florida that whoever got in and got tested, everybody, 100% of the people were positive for coronavirus. So, it's very interesting because a lot of people, as soon as they have a cold, they're really worried. Maybe I have it, maybe I don't. Let's make sure, let's get tested. And it's very rare that when you get hundreds of people, everybody comes back with the same results. But this is what was happening in Florida. Everybody was coming out testing positive. So something pretty fishy about it. And people realize that there's something fishy about it, and they cannot trust the results of these cases because they are called cases. People tested positive are called cases. Now, I have another a person that I'm in touch with. He actually works in the financial area. So they know his wife got tested, and she got tested positive. So the whole family went to get tested. So they're waiting for results, and they're waiting for results. While they wait, they got a positive results. Then she wanting to make sure, because you hear about these labs and the results are really wrong. You want to make sure that the results are correct. So she gets tested again. Yes, they're all positive. They're doing fine. He continues working. Nothing is happening. She's okay, everything is fine, the kids are fine. They just tested that they are positive, but they have no symptom or hardly any, or they're taking medication and they're doing great. But the thing that I want to bring out is like this. People that have been tested one time and want to make sure, because such a rotten system of having tests you can't rely on, they go back a second time, and they might go back a third time. All these people, let's say a whole family, goes twice. So now instead of having 4 people as pronounced cases of COVID, you have 8 people. And it's just double the amount of people that are supposedly cases of COVID, when actually it's just half the amount. And if the person would go 3 times to get tested, because I know some people that go get tested every single week, and if they were to go tested, every few days, because whatever, for work, or even because they know they have it, but they feel no symptoms at all, they're just totally fine, like a lot of people, they have the virus, but they're going along like nothing is going on. These people, they go 2 times, 3 times, 4 times, they're one person, but they are pronounced as 4 different cases or 3 different cases. So my point is like this: you can't rely on the numbers of cases that you hear about. And this situation has been so out of hand that since a few months ago, actually, in order to be a case of a person having the virus, you do not need to have the virus. You actually need to have maybe a cough, maybe cold, maybe temperature. If you have a sign of infection, you are a probable case. So let's say you have a cold. Well, you're a case. You count it as a case. And let's say you have been in touch with someone who have been in touch with someone else who was tested positive. Guess what? You're now a case. You don't have anything, but you count it as a case. Why? Because the guidelines for declaring a case or not is to be a probable case. So they figured that if you were in contact with someone who was in contact with someone who had the virus, or maybe they didn't have it, but the results showed that they were positive, you are a case. So what happened is like that. People are not dying from COVID anymore. The epidemic went down and things quieted down, but somehow you have to be kept on your toes. So how are they going to do that? Because you cannot anymore announce the number of people who died, because nobody died. What are they going to do? So what they do is announce the number of cases. There is a spike. Okay, so my mother calls me back from France and she says, in California, in America, it's so dreadful, it's dramatic. People are falling down like flies on the floor. Why? Why do people say that? Because the number of cases has increased. So there's a few reasons why the number of cases has increased. The first reason is because the tests are not good. Like I told you, because numbers are being made up. People never got tested and they get a result that they're positive out of the blue. Because the labs are doing either a very bad job or a crooked job, whichever you want to look at. Because there are so many people that are being infected with a virus which is all over the place anyway. Viruses are all over the place and we live with them, and they're not necessarily bad and they're not necessarily harmful, but this one has been propagating, and it's just people have it, but they're not getting sick from it. They just have it. And so, yes, there's more people who have it. Then what? If you have now, let's say, a billion bacteria in your stomach, you're not going to say, oh my gosh, things are so dramatic. It's just part of who we are. Have so many bacteria, but that I'll go about it another time. Another thing is like this, the number, so you understand that the number of cases is becoming totally irrelevant, because the number of cases is just the number of people that are we're throwing numbers at you just so that you can keep excited about it, or else there's no more news. So that's one thing. Another thing is that is very, very important is the mortality rate. In other words, if you have one person who dies out of 100, that's a 1% mortality rate. If you have one person out of 1,000, it's a much lower, 10 times lower mortality rate. So how do you keep up mortality rates? So in the past, the guidelines coming to the hospitals from medical administration and health organization, they were told again that whoever has a possibility that they got in contact with someone who had COVID, if this person dies, they're written off as a COVID death. That sounds a little bit funny. You say, well, why can't we do an autopsy? No. No autopsy is necessary. You don't need to know that a person who died had COVID. You just need to figure out somehow, in the people that were in contact with in the last few weeks, was there anybody that happened to have been diagnosed with COVID? And that was enough, and that is still enough, to declare someone dead as a COVID death. Now, let's say you've all heard of the person who was unfortunately in a traffic accident, car accident or motorbike accident, and got COVID death. You've heard of people that died of a heart attack, COVID death. You heard of people who had pneumonia, COVID death. That is very clear and simple, because any death where the person was not able to breathe at 100% well is a pulmonary dysfunction, and anything to do with pulmonary dysfunction is written off as a COVID death. So let's say I go to the dentist, and the billing assistant tells me that her aunt's mother, a very old lady, was living with them at home, and she was been, very old and weak for a very long time. She passed away in a bed, quietly, but quite old. She passed away of old age at home. So, what was written on her death certificate? COVID. Did she have COVID? No. But that is how the numbers have gone up. If you probable case, you don't have to be determined, and it doesn't have to be proven. It doesn't even have to be diagnosed. It's a probable case of COVID death. Now you can see how these numbers go up. And you can see how they're very unreliable. And you can see that maybe you cannot see, but maybe you haven't asked people. want to say that a lot of nurses have been told to write that the person died of COVID, even though it was not true. There is now an organization called Frontline Physician that is going out teaching people what is actually going on in the medical world, because people have a hard time. Like my friend said, how could the coroner write down that this person died of COVID if they didn't? So I said, how does the coroner knows of what death the person died of? So she says, well, they asked the doctor. So I said, here you go. The doctor said COVID, coroner says COVID, and that's all there is to it. So it's been now more and more in the open. Less secretly in places, more secretly in some, that the administrations of the hospital are pressured, and they put that pressure on the doctors and the nurses to declare a lot of things as COVID when they're really not. There's two reasons for that. First, because there is guidelines that they receive and they have to obey. Because don't remember that a lot of hospitals are under government and state control. Some hospitals are private hospitals, but a lot of them are under government control, and therefore they have to follow government guidelines. Another thing that is putting a lot of pressure on people to do things that are obviously not ethical is because they will be fired if they do not obey. Now, people have a hard time with that, but that's the truth. And this is a truth that not everybody wants to look at squarely in the eye, but the truth is that the hospital can fire their doctors, they can fire the nurses, and some have been fired. And it's a very difficult thing for a young doctor who has not finished his career of 30 or 40 years, who has gotten married, who has gotten children, who has gotten a house, and has debts, and has to make a living for his family, to be now to lose his job, but not only lose his job, but have something on his record that he cannot anymore work for any other hospital or any other doctor's office. It's a very risky proposition. People have debts from going to medical school for 15, 20 years. And not only they have debts, but they have now bought a car, have to pay tuition maybe or not, or maybe a mortgage. What are they supposed to do now? Quit all this time that they put into work and now let it go because it's the right thing to do? You're going to find very few people able to do that. So the friends and the doctors and the nurse in the hospital obey the rule. So there is also now an organization that started in Germany of doctors that are putting their names because they on the list and are going out public also, because they see so many things that are going wrong and that are lies and that are against the medical profession, that they decided to go public. And it's going to cost them, but they're willing to do it because they've seen laws and guidelines being implemented. Like if somebody has a heart attack, or if somebody has any kind of pulmonary dysfunction, they are now told not to try to resuscitate the person to help them be alive anymore. There is all kinds of things going on that you would not believe. There's been secretly told, because people again cannot lose their job, but some patients being admitted to the hospital and getting shots with shots to literally kill them. And there's a lot of things that are going on that are very fishy. So why you don't know about this is because the medias, including Facebook, YouTube, and certainly Google, are taking it off. I've had video taken out. I'm going to make a series of very short videos because I know that if I say everything in one video, I have chances of just wasting my time because it's going to be taken out. So I'd rather make a few short ones. So today, I just wanted you to understand that when you hear the news and you hear that there is a mortality rate that is very high, you have to take it with not a grain of salt, with a lot of sea salt, like you see behind me. All right? Thank you for listening. Please share.